Well, good morning, everyone, and what a treat it is to be here with so many people who I have met in the past and are new friends, and look forward to sharing some of my experiences with international neurosurgery and where I've ended up with nutrition, and kind of the story of how I got there. Sorry, this is obviously right. And I have recently retired from neurosurgery. And I'm just going to go through a little bit of my past. I grew up in Canada. It's colder in Canada, snows more. We have lovely summers, and of course, hockey is a big part of Canadian life. I did my medical school at the University of Manitoba. For internship, I went to Los Angeles, where I was at the county hospital. It was a lot different from Manitoba, particularly the politicians. You might recognize this from the Terminator. I returned to Canada after my internship, and I attended then the University of Calgary, where I was the second Canadian female neurosurgeon. My daughter, who you saw was the third neurosurgeon in Canada. I would have stayed there, except they blew up my hospital, the Calgary General Hospital, for financial expediency. One wonders about political decisions, of course. So after that, I had established a spinal injury program in Calgary, and I was very disgusted by the whole situation. So I moved to the United States, and myself and my other neurosurgical partner, Oliver Dold, ended up in Decatur, Illinois, and I spent a very pleasant 11 years in Decatur. And I ended up changing at that point, I had been a neurosurgeon for close to 25 years, and a series of family situations really required my attention. And so I had to figure out a way to slow down from neurosurgery. And most of you in this room know that that's not an easy thing to do. But I ended up doing part-time neurosurgery, taking a lot of call, because I always actually enjoyed the call aspects of neurosurgery. I found the most interesting patients and the most challenging parts of it. So I actually decided I was going to spend my neurosurgical career doing a combination of call and administrative work. And I was actually inspired by Dr. Dempsey at one of these conferences to do international volunteer work. So I ended up in Corvallis, Oregon, which is a delightful spot. I truly did land butterside up on this one. And I now have a lovely cabin at Cascade Head Ranch. I'm retired, and I have spent a lot of my life doing now, the last 10 years, international volunteer work. So my first experience in this was in 2009. And here's Dr. Susil Sipakar and the Tribhuvan University Teaching Hospital at that time. And he is truly an inspiring individual. I can't imagine going to China, learning Chinese in 2 years, and graduating from medical school, returning to Nepal, and then being trained as a general surgeon and neurosurgeon. I mean, truly a very inspiring individual, and it was a real privilege to work with him for 2 to 3 months. But when I was there, I was struck by some very talented young people. Ali will recognize Bishnu there. I taught Bishnu his very first craniotomy. And Narendra Banskota, who is now a neurosurgeon with the Army. And I realized that these young, talented people really had incredible knowledge of basic medicine and surgical technique. And I was so impressed by their capability, and really felt that what they needed a lot of was equipment and support. And obviously, Fines had an extremely capable group of volunteers. But what I was struck with was in the outpatient clinic, the incredible number of neural tube defects that we saw. And I came to realize rather late in my career, the importance of public health.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.